As of now, it appears Democrats will hit the magic number of 60 votes on whether to move on to debate the health care bill. This is a live look at the Senate, where that vote is expected to take place later tonight. There you have Senator John McCain, and joining us live from Capitol Hill, another Republican, a Senator, Richard Burr of North Carolina. Thank you very much for talking to us. I want to make it very clear, we have reached out to many Democrats, none of which will come on today. However, they are willing to hold a news conference later in the day. So as much as we'd like to make this as fair and balanced as possible, for some reason the Democrats just don't want to talk to us today. I guess they're very busy.
Well, I guess they are. I take for granted they're going to have a 60-vote threshold tonight. We'll proceed to the bill, and we start the process of educating the American people over the next weeks and months.
All right, well, let's talk about one of those busy Democrats, Senator Blanche Lincoln of Arkansas. She says she's not going to vote on the proposal the way that it is currently written, particularly that public option she has some real problems with. It seems a lot of Democrats are actually having a lot of problems with a lot of portions of this bill and maybe finding themselves disliking parts of this bill that Republicans find issue with. Are Republicans and Democrats actually agreeing on something here?
Well, I think there is agreement on certain areas, but I think, Julie, what Blanche has forgotten is that this process will take 60 votes to change anything in this bill. So we could have 40 Republicans in favor of changing the public option, but if there are not 20 Democrats willing to stand up and commit to that, then this bill stays the same. So we're going to go through a process where the American people are going to have ample opportunity to learn what's in the bill and to weigh in with Democrats that feel certain that they've got to protect this language.
Okay, we just heard from Republican Senator John McCain. Alexander is now at the mic. McCain speaking out against this bill. On Friday, in fact, McCain sent an email urging his supporters to call Mr. Nelson and ask him to vote no on government-run health care. Now, Senator Ben Nelson of Nebraska is actually one of 3 wavering Democrats. Are Democrats offering any room for negotiation here?
Well, Julie, up to this point, we've extended our hand and said, let's do this in a bipartisan way, and our hand hadn't been met. Clearly, as we move towards 8 o'clock tonight, this is one vote in a long series of votes as we review this bill. But I think that it's safe to say that it's the public option, it's the expense of this bill, over $849 billion. It's the transfer of $464 billion from Medicare to pay for this new entitlement. There's so many areas in this bill that need further work before we could ever move forward. But one thing is for certain, this is not a health care reform bill. This is at best a coverage expansion bill.
Republican Senator Lamar Alexander, who was just speaking there moments ago, a Republican from Tennessee, he has come out and he has discussed health care reform and urged Congress not to pass this thing for many reasons, but he says the Democrats' bill is indeed historic in its combination of higher premiums, higher taxes, Medicare cuts, and more federal government debt. This is going to cost taxpayers billions of dollars. It's going to make cuts on Medicare. Let's talk about the effects this will have on American seniors.
Well, on American seniors, for 11 million American seniors that choose Medicare Advantage as their preferred plan of coverage, that's basically going to be eliminated. They're going to lose the benefits. It's going to affect the low-income seniors the most. They're going to have more out-of-pocket requirements. It'll affect every senior because there is not a fix to physician reimbursements in this bill. Fewer and fewer physicians are going to see Medicare beneficiaries. So not only will the benefits be affected, who you get access to will be affected by passage of this bill.
Republican Senator Bob Bennett of Utah speaking right now, and now we've got John McCain. They're going back and forth here. They are arguing very hard in order to prevent this thing from hitting the floor and passing through the debate stage in order for it to actually move forward into the voting stage. So there are many, many stages here. We're talking about $900 billion. Majority Leader Harry Reid believes he has the 60 votes needed in order to get this thing passed. All right, so let's just talk us through this, if you will. Let's say we get to tonight. This thing passes, it reaches debate. Then what?
We start November the 30th, Monday, a week, to begin to consider the bill. A lot of that time will be spent on educating the American people. Then we go into the amendment process. This process, in my estimation, would last 6 to 8 weeks. At some point, we'll bring things to a conclusion. There will be another 60-vote threshold to end debate and to stop offering amendments before we ever get to a final passage.
Right.
And before we ever interact with the House of Representatives.
Senator Bennett said, and I'm quoting, the #1 assignment in 2009 is to kill Obamacare. If this reaches the debate platform, that doesn't necessarily mean that this bill is going to go through.
It doesn't. There's a lot of play left in this bill. The American people are getting the first opportunity to weigh in with this vote tonight. So this is just one in a series. And I think when they realize this affects all 50 states by requiring 15 million Americans to be covered under the state Medicaid program, probably the most inefficient, most costly delivery system we have in this country, one that contributes the largest share to the cost shift from the meager reimbursements to healthcare providers.
All right. Well, thank you very much for talking to us, Republican Senator Richard Burr. And we'll be hearing from Democrats eventually when they hold their own news conference. But in the meantime, we'll continue to put calls out to them. Thank you very much, sir. And you can bet that